This leads us to the bladder. And of course, the bladder specifically has a few pathologies itself. There are, in this case, 3 stones that are palpable within it. This, again, guides the surgeon to perceive there to be a problem. There's stones there. He doesn't know how many, so he must open the bladder, remove the stones, but thoroughly pass a catheter, clearing it, and then passing it again. We will occasionally hide stones, and it is a way of testing whether they're thorough in their pursuits and whether they take the dog seriously.
You can either create and flip your blade upside down, and just like the linea, do the reverse stab incision up, and then extend with a pair of scissors. Or you can paint down with the blade until you're in the lumen, and then extend with scissors. But I think either of those are fair.
Ready.
Stones. When you guys are suturing the bladder, please ensure again you go serosa to mucosa, mucosa to serosa to ensure that you engage the submucosa. Use your needle here to grab the loop. Pull up, right? That's going to tension the previous sutures that you placed, and then pull it down. And as you pull it down, you're going to be able to put it in the position that you want the suture to lay. And then once you're there, try not to move the knot, and then it's another additional 5 throws here, so 3 total square knots. And I like the way you're flattening your hands. Rock your hand and your needle driver in your hand as you go. And so as you rock it, it's going to tighten each side now. Looking at this, right, the only area that I would say maybe you're a little wide on that bite would be right here, right? And so you'll always be able to push a hemostat through, but we can kind of gauge the degree of apposition, and it's pretty tough to get through. If you were nervous about that and you wanted to sleep better at night, a simple interrupted right there would be fine.